Good morning, ladies and gentlemen, and you are welcome to this live webinar session brought to you by SP Lagos section titled Effective Management of COVID-19 Protocols for Offshore Drilling Rig Facilities, specifically the Valaris DS-10 operated by Shell Nigeria Deepwater Wells and Ocean Deep ESV Nigeria Limited. Before I introduce our speakers, I would like to quickly take a safety moment. So, as we are all aware, we are still right in the middle of a global pandemic caused by the coronavirus. And even though things seem to be going back to normal or are back to normal in Nigeria, especially here in Lagos, the NCDC have indeed reported a rise in cases around Nigeria. So, of course, as a precaution to stay safe and limit the spread of the virus, we are advised to always wash our hands frequently with soap and running water. If soap and water are available at the time, you can always use an alcohol-based sanitizer. You're advised to always wear a face mask when you're out in public. You have to avoid large gatherings, and if you feel any COVID-19 symptoms, you are advised to self-isolate and call the NCDC on those numbers. So I would like to introduce our speakers now. First off is Kingsley. Okay, Kingsley is currently a Shell drilling supervisor on a drill ship in the Bonga Deepwater Field offshore Nigeria. He has written papers that are featured in NICE, Offshore Europe, and OTC. He attended the Federal University of Technology, Owerri, Robert Gordon University, Aberdeen, and currently a doctorate candidate at the Schema Business School, France. Kingsley, you are welcome. Our other guest speaker is Kemi Ogunlesi. Kemi is a rig asset manager with ODENL, responsible for delivering operational excellence by ensuring minimal equipment downtime, as well as executing rig modification projects for improved efficiency and reliability for Valaris DS-10, a 7th generation ultra deep water drill ship. Prior to this, she worked as an operations engineer with Transocean, providing support with operational performance issues and review of performance benchmarks. She has over 8 years experience in the offshore drilling industry with a focus on reliability, maintenance, and performance. A graduate of electrical and electronics engineering from the University of Ibadan. She also holds a master's degree in drilling and well engineering from Robert Gordon University, Aberdeen. You're welcome, Kemi. And I remain your host, Chuks Kerry. I am the SP Lagos YP chairperson. So without further ado, I welcome our speakers to give us this very exciting and very informative webinar. Thank you.
Thanks, Chuks, for that wonderful introduction. So without further ado, I hope everyone can see the slides, and Kingsley will be kicking off with the introduction.
Good afternoon, everybody. So we're here to present the effective management of COVID-19 protocols, for an offshore drilling rig. And that case study is going to be with Valaris DS-10. So Shell Nigeria Exploration and Production Company, that's NEPCO, it's the deepwater arm for Shell in Nigeria. And we're in partnership with Valaris DS-10 a 7th-generation rig operated by ODNL. So we've been in partnership over the years, and we got, like every other person, in January, a stop and a start, right? And we're able to do that by actually putting in place a very effective management of COVID. So right now we are in operations and we're going strong. So this presentation will just highlight, what we did and what the results are. Next slide. So, yeah, we all know the pandemic. COVID-19, it's an infectious disease caused by coronavirus. The first case in Nigeria was on 27th of February in Lagos. It spread by droplets, tiny particles released in the air when people talk, sing, exercise, cough, and sneeze. The symptoms may appear within 2 to 7 days after exposure to the virus. So 99% of people will have symptoms between 2 to 7 days after they get exposed to the virus. Also, the person does not need to have symptoms to spread the virus as well. There are several ways in which we've found how to diagnose COVID-19, but the most reliable is the PCR test. So most people use the PCR test because it's almost perfect. It's not perfect, but it's almost perfect. The symptoms include common cold, fever, dry cough, tiredness, loss of smell, loss of taste, headache, difficulty in breathing, chest pain, and in more severe cases, loss of speech and movement. As at the 10th of this month, we've had about 50, almost 60 million people with COVID-19. About 1.2 million, 1.3 million people have died. In Nigeria, we've had 63,000 cases as at the 7th from NCDC. About 1,150 people have died of COVID-19. So I'll hand over to Kemi to outline the strategy Shell and Valeris employed, right, to manage COVID-19. Kemi, take it away.
All right, so as mentioned earlier, so the DS-10 is an ultra deepwater drill ship that is working on Bunga Field with Shell. And so to get back to operations, we came up with a robust COVID-19 management plan, which comprised of both prevention and mitigation measures. Right, so as we see on the slide, on the left side of the bow tie, that is some of the preventive measures that we have put in place. And on the right side, mitigation measures, also that we can prevent an outbreak of COVID-19 on board. Now, some of these prevention measures, which we will be going in to discuss in detail, include quarantine before boarding the rig, include COVID-19 testing. Kingsley mentioned about the PCR testing. It's also, we're going to talk about how do we move personnel to the rig, and when they're on the rig, how do we manage social distancing? We'll also look at contact rings and contact tracing. So when personnel go on board, how can we quickly identify people that they have come in contact with? So that's on the prevention side. Now on the mitigation side, we'll look at, okay, for if any of these preventive measures fail, and we happen to have a confirmed or a suspected or a confirmed case on board, what then do we do? So what are the actions that we will do to prevent it from spreading further? And so we'll talk about that on the mitigation side. All right, so to move along to prevention. So we'll start the prevention measures starting with the quarantine. So now everybody, like all personnel that go out to the rig, must undergo a mandatory supervised quarantine. Now, even if you are going with the job that you have to do on the rig is only for 1 day, you must go through this quarantine period at the OTC. So what we have is a pre-approved facility. It's a hotel, but has been vetted and has been approved. Measures have been put in place at that location for quarantine purposes. So the quarantine duration, the quarantine period is in line with NCDC requirements. So initially that used to be 14 days, but this has now been revised to 7 days. So in line with the NCDC, all personnel must check in at the OTC. They will be under supervised isolation for 7 days, and on the 7th day, and they undergo 2 tests, which we'll discuss in a bit. So if they do have negative tests, then they are cleared to go offshore, and then they will go offshore on day 9. So how does this testing work at the OTC? So all check-in day is day 1. We'll count that as day 1. So before you arrive at the hotel or the OTC, you would have filled a pre-arrival questionnaire. So this questionnaire is a standard form that would, ask you questions about your previous history, who you've been in contact with, your symptoms at the moment, if you have any. So if you have a cold, you have a cough, whatever you're feeling, you have to declare in this pre-arrival questionnaire. So then you get to the OTC. And as you are being checked in, there's medical staff on ground that will take your sample. So they will take a first sample for you and then do a PCR test. That is day 1. So we get the results of our testing in 24 hours. So you would ideally get the result on day 2. So for the first test, if your test is negative, you will continue to stay in quarantine at the OTC. But if your test comes back positive, on day 2, you'll be asked to check out in line with our checkout protocols. So let's assume that your test is negative, your first PCR test is negative, so you continue to stay in the OTC for the quarantine duration. So on day 7, another PCR test is taken, and we get the results again in 24 hours, so on day 8. So the second test will know if you are negative or positive. If you are negative on that second test, then you receive clearance to go offshore, and you'll be booked to the rig on day 9. Now, some people might be asking, well, how come you can be negative on day 1 and then positive on the second PCR test on day 7? Well, we know that the COVID-19 virus has an incubation period of about 4 to 5 days. So it is possible that if you have just freshly contracted the virus on maybe the day before or on the day of check-in, right? Maybe on your way, as you're making your way to the OTC, it is possible that you may have contracted the virus, and that virus will be incubating in your system for 4 to 5 days. So we need to do a second test on day 7 and to make sure that indeed, this is not the case. So we have seen instances where people test negative on the first PCR test, but then they do test positive on the second one. So that is why we have to make doubly sure and do two tests. So to go offshore, both tests must be negative, and then you receive a clearance, and then your helicopter, you are booked to go to the rig. Now, how do we move people to the rigs? So personnel movement is by helicopter, right? So at the OTC, arrangements will be made for all personnel who have successfully passed or have gotten the clearance to go to the rig to be moved to the heliport by a crew change bus. Now we have implemented measures as well for boarding the bus and as well as the journey itself. So 60% occupancy. We maintain 60% occupancy in the bus. So for example, a crew change bus that can normally take 10 people would only take 6 people, and they will be adequately spaced, in the bus. And then when they arrive at the heliport, there are pre-departure screening measures as well that the heliport has put in place, right? And there's also social distancing. So there are labeled markers on the floor for where people should stand to ensure the social distancing through the whole boarding process, as well as luggage disinfection. So You can see on the picture on the right, we have luggage disinfection both at the heliport as well as on the rig. So what is pictured here is the disinfection on the rig side, but before the luggage gets to the rig, it will also have been disinfected at the heliport. Now masks must be used all through, so all through the journey to in the bus to the heliport, all while at the heliport, and all through the chopper flight, every personnel must use their masks. And then they arrive on the rig, right? So how can we ensure that we have adequate, or we can quickly trace all primary and secondary contacts of everybody? Now what we have come up with is this contact ring management system, and everybody is going to be assigned to a specific contact ring. Now what is this contact ring? Everybody is going to be assigned a contact ring based on your work shift and your work area. So there are 4 work shifts on the rig. So you can either work from 6 in the morning to 12-hour shifts. So you can either work 6 in the morning to 6 in the evening, or you work from 12 noon to 12 midnight, or you work 6 p.m. to 6 a.m. or midnight to 12 noon. So those are the 4 shifts that everybody has to work. So based on that, we have 4 main groupings, right? So we have blue, black, yellow, and green. So CRA, CRB, CRC, CRD, right? Then these groups are now further subdivided on the area you work. So for example, if I worked on the drill floor, for example, I will be in work area 2. Now, I work on the drill floor from 6 in the morning to 6 in the evening. I will be in CRA2, for example. And then the entire rig is divided into 20 different work areas. So depending on where you work, so you'd have a work area for people that work on the drill floor, a work area for people that work on the deck, a work area for people that work maybe in the ROV area of the rig. So there are 20 different work areas which we have divided. So as soon as you get on board the rig, you will be given your contact ring assignment. And along with your assignment, you'll be given a sticker as well as a badge to be worn. Now the sticker must be worn on your hard hat when you're outside the accommodation, and the badge must be worn on your accommodation coveralls at all times. So easily, when you look at every person, you must instantly know the contact ring that they belong to. So contact ring identification must be worn at all times. Now, any interaction outside of your contact ring must be recorded. So for example, I work on the drill floor. Most of my interaction will be on the drill floor. If for any reason I need to interact with someone who works on the deck or someone who works in another work area, it must be recorded. So we have an exemption form that we fill, as well as a trace log that we fill. So the day and time that you have interacted with someone outside your contact ring must be recorded. And then as well, your cabin assignment is per your contact ring. So the whole essence of the contact ring system is to make sure that you are I won't say confined now, but you're limited within, so that you are limited within the contact ring that you belong to, so that what you eat by your contact ring, you're assigned your cabin by your contact ring, and you walk by your contact ring, and so that we're limiting the interactions between different people on board the rig. Beyond the contact ring, so yes, we will give you a contact ring assignment, but then we also have the social distancing and face masks which come to play. So COVID-19 really has redefined the way we walk, the way we eat, and the way we play on the rig. So how it has affected the way we work. So, like I explained, you have to use the face mask within the accommodation, right? When you're having all your pre-tower meetings, everybody must use their face masks. And when you're doing your pre-job GSA discussion, so pre-job, before you do any task on the rig, people must come together. Everybody that's involved in that task must come together and brainstorm and talk about the inherent risks that are associated with that task. So because you're having people coming together, even though they're people of the same contact ring, you still need to ensure that they are protected, so everybody still uses their face masks while they're having that GSA conversations. And then also when we're having shift handovers, so if I walk on the in the doghouse on the rig floor, for example, from 6 a.m. to 6 p.m. And I have a back-to-back who's going to resume at 6 p.m. Just before he resumes at 6 p.m., I must do a wipe down and disinfection of my work area so that we're limiting cross contamination or cross infections. And then for eating as well, we have reduced the capacity in our mess rooms. So whereas everybody there was free seating based on the number of seats that are in the mess room, we have reduced that capacity. So we have removed some of the seats and assigned the seats so that it's well spaced. We've also had staggered meal time. So whereas before where you had 1 hour for your lunch, we've broken it up so that people go in batches of 30 minutes. So you have 30 minutes to quickly have a meal and come back and resume your duties. And then we no longer have any self-service options. So before, where you had fruits, etc., some other salad items that were on a buffet regimen, we no longer have that offering. The catering staff must serve everybody. And then while you're in line to get your food, we have social distancing markers. We'll see some pictures, as we go along. And then also the way we play. So it's not just walk. It's the 12-hour shift where you walk, and then 12-hour shift downtime. So how do most people spend their downtime? Either in their rooms, they watch TV, go to the gym. What we have done is that we have first reduced the capacity of all these facilities, and then there is a log that you feel, this is we need to maintain traceability of where everybody is at any time, and then we ensure that there's frequent wipe down of these areas. So the catering staff and cleaning staff are aware of this increased cleaning protocols. And then again, even the use of elevators and the accommodation, right? So whereas before, everybody, as long as we were within the capacity of the elevator, everybody could use the elevator. Now you can't. First of all, we have reduced the capacity of the elevator. We can only have a maximum of 4 people in the elevator at a time. And it has to be by contact ring only. So if you press the elevator, for example, and you see that there's already an occupant in the elevator that is not in your contact ring, unfortunately, you cannot enter the elevator. So you need to either wait for him to get to where he's going, then call the elevator back, or you take the stairs. So these are some of the pictures of what I've tried to explain. So we can see a picture of some people. This is a pre-trial meeting, top left hand of the slide. Everybody's using their masks and there's adequate spacing. So you can see that we have reduced the capacity at the during the pre-trial meeting. Same with the heli lounge as well. You can see that chairs have been crossed out so that we can have adequate space out. Same applies in the TV room where it's crossed out, and then adequate spacing in the galley. Now you can see this picture on the right that says, picture on the right that says contact ring assignment for the tables as well. So even when you eat, you're supposed to eat by your contact ring. This will allow us for easy traceability if perchance we have an infection on board. Now we know that we're all human beings, right? So there's the opportunity, or there's the chance that we will slip up or forget. So we need to constantly keep communicating what these measures are and reinforcing these measures. So what we do is we communicate these, by signage and posters, first of all. So primarily, you have social distancing markers everywhere on the rig. So everywhere that we need, that there will be a line or there will be a queue. So for example, this is in the galley. You can see that there's social distancing markers. There's hand sanitizer stations all over the rig. So, you can't walk 10 steps without seeing another hand sanitizer station. Right, there's a post-stage signage in front of the elevator that has that's states the maximum occupancy, as well as the fact that you must use your face masks, you have to abide by the contact ring. So there's this signage all over the rig, because we know that people need to be reminded. We're human beings, sometimes you can forget, as well as reinforcement. So in the pre-trial meetings as well as the weekly safety meetings, these measures are reinforced, right? So we talk about the measures that we have in place, and we're constantly reinforcing that so that it is ingrained into people. And I think, yes, and that is it. And those are the measures that we will be discussing on the prevention side. So now to talk about the measures that we would take should there ever be an outbreak, regardless of all these preventive measures. So Kingsley will talk about some of these mitigation measures. Now hand it over to Kingsley.
So for the mitigation, we know we're working in fine lines. The PCR test, for a start, is not 100%, so there might be a slip there. And if we have those kind of slips, it means it's probable, right, that we can have an outbreak on the rig. So, and that's why we also take mitigation very seriously when we have that, and everything in between, right, from the contact ring, is to actually minimize abrupt stop to operations and maximize the fact that people will not get affected. So one of the way we came up with the strategy, right, was to divide it into two, right? If you have, let's say, a single case, and also a multiple case. So if you have a single case, it's easy. You can isolate that person and medevac the person to town. If you have a multi-case, it's more complex, because sometimes it might affect a lot of people that you have to shut operations, or it might affect critical people that you may have to shut operations on. So that's how we kind of strategized it. So for the when we have an outbreak, right, there are immediate responses we have to carry. And so first of all, the medic kind of observe the illness or the symptoms in the person. And obviously he wears a surgical mask to attend to the person of interest. So the medic kind of isolates that person. Then they test for other illnesses. So, the COVID-19 symptoms look like malaria, right? So you have to test for other symptoms like malaria. While waiting for the results, right, they will have to notify the rig leadership. The rig leadership comprises of the captain, the OIM, and the Shell senior DSV. So once it has been confirmed that this person has, it's positive, right? If the person is negative, the person can go to work. If the person is positive, then we activate, what we call the ERT process. So the first thing we do is to identify all primary contacts. Remember our contact rings. Everybody with the person's contact is identified and isolated, right? Because COVID-19 is very, very viral, so we'll take no chances. Once we do that, then we kick off, all our ERT protocols. Call town. Town will activate, all the processes we need to use. So what you see on your screen, right, it's all the different points in which we activate our ERT processes. For the respondents, right, site medics obviously are important. We have also doctors in town, right? We have our our aviation reps, and we have all other processes that we use to do that. However, when things are, once we discover that it's only that person that has it, we'll take the person out, walk operation continues. But if it's multiple, it's in the case of a multiple suspect case, it becomes more complicated. It means you have to shut down your rig. And sometimes you'll be doing an activity that it takes time, right, to actually safely shut down that rig before you evacuate everybody everybody on the rig. So one of the things we do is to measure what we call the T time. The T time is the time it takes us to safely shut down the well and move, right? So at every point in time, we try to record our T time. So okay, it will take us 5 days, it take us 3 days, take us 2 days to shut down the well and sail. And it's very important because you want to track, or you want to be able to manage your response very well. So in the process, when there's a lot of people, especially when there are critical people that have COVID-19, what the plan will be is, again, you activate your ERT. You will also start activating the whole shutdown process. Again, depends on where you are in operation. Sometimes it can take 2, 3, 4 days to actually secure your well. Then you will have to plan whether your kind of transit. If it's a lot of people, you may have to evacuate them by sailing the rig to town, right? If it's not a lot of people, but you can manage it with the choppers, then you can use choppers to evacuate them. So if you're using air, right, it's very easy. So your personnel movement, you move the personnel to the helipad. You call your service providers, the helicopter service providers. Usually our helicopters are like 11 people per flight. Yeah, in a day we can do 6 flights maximum, right? And approximately 3 flights to and fro. So you can now know, okay, look, I can only do 6 flights maximum, and it will take me, if it's 180 people that, for example, has COVID-19, so you can now calculate how many days it will take you to evacuate everybody using chopper. But if you're doing by sea, we also have that in plan. So you will use boats from the rig to Lagos. We have bases in Lagos that we can, or jetties that we can land our boat in. That's one point. Or we can actually sail the rig, all the way to town. So basically, that's the 2 major strategies in which if we have a positive case, in which we can be able to evacuate people. When people are in town, the next thing is to follow all the NCD government procedures, right? So, because NCD has a way of, or a fixed way of how to treat COVID-19 patients. It's changing, so we always look at the NCD side to know what the latest is. If you can remember, there was a time where government had to handle them. So government had dedicated centers, and Lagos State government had dedicated centers, but there is a new process in which they have to close all those dedicated centers, and they've assigned special hospitals to treat COVID-19 patients. So the ERT, the next slide shows different components in activation of our ERT. You can see the 3 scenarios. When you have single, when you have multiple but in the same contact ring, and when you have multiple but in different contact ring. At every point in time, we have to look at this spread or this sheet, right, to know all the components that are needed. And not just knowing that, oh, I have this component, you also have to check on them, right? You also have to check that those components or equipments are ready for you. So for example, transit clinic onshore, right? You don't have to just, keep doing operations. Every single day, you have to check whether the regulations have changed, and what are the new regulations, what are the new guidelines. Training, you can't just stop because things are changing quickly or things change quickly. So you have to keep training your people how or what is required, right, to treat this or to save people or to evacuate safely. And one of the things we do is to do drills. So, from time to time, we do a drill for everybody in our this respondents place to know or to remember or to act on how to safely evacuate people. And in those drills, we identify gaps and we close them out. So the next slide just shows the contamination, because if you have a multiple case, for example, and you take everybody out, you need to decontaminate the rig. So again, we're ready for that. We have all the chemicals, all the cleaning materials, and all the expertise to do a proper decontamination. And I'll let Kemi discuss some numbers so you see the result we have so far.
All right, thanks, Kingsley. So yes, we discussed prevention measures, we've talked about mitigation measures. So what are the results of all these measures that we have put in place? All right, so we're going to look at it. So earlier this year, due to the COVID-19, airports were shut down, logistics, were disrupted. So the rig was actually on standby. The rig was not in operation at the moment, and that was when we came up with this COVID-19 management plan for when we resume operations. How would we handle it? So we got back into the Bonga field on 16th of September, and since then we have executed 3 wells. We're currently on our 3rd well, and we've had 55 days COVID-free so far. Well, this is as at yesterday. We have done approximately 1,300 COVID-19 tests, and we have almost 80,000 man-hours. So, but we can't rest on our oars and say, oh well, we have achieved this. We have a golden standard. We always need to keep, first of all, taking it one day at a time, and secondly, reviewing and examining what the processes that we have put in place are and how we can, improve them and make them better, fine-tune them. So we call these operational assurance checks. So regardless of all the measures we have put in place, we have to make sure that, well, these are really indeed robust, like we think they are, and how to make sure that nothing slips through the cracks. So one of the ways that we do this is, first of all, we have a dedicated medic on board for COVID-19 related monitoring. Right, so this dedicated medic, apart from the regular rig medic, focuses only on COVID-19 cases, quote and unquote. So if you have a crew member, someone on board the rig that reports COVID-19-like symptoms, the medic is the one to attend to that. So she would evaluate the symptoms, like Kingsley had mentioned earlier. We all know that some of these symptoms are similar to what malaria looks like. So, we have that ongoing. Then we do daily random temperature checks on board, because we know that some people don't have any symptoms per se, but their body temperature will be elevated, but they're otherwise fine. So one of the measures we do for our assurance checks. And lastly, like Kingsley mentioned, we do COVID-19 drills. So for the mitigation measures, we need to make sure that all the facilities that we say we have access to are really there. So what we'll do is we'll simulate and for the drill, we'll simulate a situation where there is someone with COVID-19 on board, and we'll go through all the actions. There's a flow chart of actions that we're supposed to take in that scenario. So we'll go through all that with the actions. We will make the calls that we need to make. We'll ensure that the clinic is available. We'll ensure that the medevac helicopter is available. All the facilities and resources that we say we have available, we need to double check and make sure that they will be available in case of an emergency. So that's what the drill covers. And so we make sure that at any given time, we are ready and we are prepared. And that brings us to the end of our presentation, where we would gladly take your questions. Thank you.
Okay, thank you so much, Kemi and Kingsley, for that presentation. I'm very sure our listeners would agree with me that it was indeed brilliant and informative. I mean, just in case any of us was wondering just how offshore drilling facilities, managed personnel and operations amidst this pandemic, I believe we all have a very fair idea now. Thank you again. So I have a few questions. I'll run through them one after the other. The first one is from Karen. She's asking, can we get the slides? And I believe I can answer that question. The answer is yes. Just reach out to us, splagos@gmail.com, and we would get back to you. So the second question is from Anonymous. Thanks for the very brilliant presentation. On the overall, how has this protocol impacted on drilling schedule?
So I'll answer that. So what we did is we've measured these 2 wells plus we did post-COVID and pre-COVID. The numbers didn't change. So what we realized that it didn't really affect the numbers per well. But what it did affect is the period of the lockdown, where we had to lock down and plan, right? So in your schedule, for example, for 2020, obviously, that period in which we locked down, we had to stop. And so it affected the 2020 sequence or 2020 schedule. But individual well basis, the timing remained the same.
Okay, thank you, Kingsley, for that. We have another question from Sheon O. Can you please explain more about the contact ring? Is it actually rings that the personnel wear on their fingers? Is it like an electronic tracker? Kindly explain further. Thanks.
All right, so I'll take that question. I'll also scroll back to that slide, because there's a picture of what the actual ring looks like. And it's not a ring, it is, hold on, I'm just gonna take it back here. So I don't know if you can see the top, next to the contact rings, the title, you can see a circle, right? So that is a contact ring. That's a picture of an actual contact ring for someone who belongs in CRA1. It is printed out as a sticker for the hard hat, so it's just a flat stick-on paper on your hard hat, as well as a badge. I don't know if you are familiar with like badges that you can sort of stick on your clothes. So that's how it comes. So it's not in actual form of it. The format of it is not a ring, or it's not digital. It's, unfortunately, we haven't reached that level yet where we can have like a RFID digital contact rings. So it's still quite manual, but it's a bold sticker on your hard hat. So when you're out on deck, you can see it. And then when you're indoors, it's like a pin that's attached to your coveralls, your indoor coveralls.
Okay,
so I hope that answers
thank you.
my
I
question.
think yes, it's very clear. I actually also wondered if it was an actual ring you place on your finger or something fancy like that. But thank you. I think it's quite clear now. Okay, we have another question. This is from Cher. With the recent announcement of effective vaccines, is there any plan to make vaccines available to personnel?
So I'll answer this. So the rig has, 20, 30 different nationals from different countries. So the plan really is for you to follow your government guidelines. So for me, I'm a Nigerian, right? I have to follow what our government says. It might be, we don't know what the plan is. It might be government distributed. It might be private sector distributed. We don't know. But this method, right, or this strategy is going to continue until we are very sure that we don't have COVID-19 out there. Again, we will still modify the strategy as we see things go, but it's going to continue like this until we are very sure we cannot put someone with COVID-19 on the rig.
Okay. I'll just, before I take the next question, I'd just like to mention that there are several comments from attendees thanking you for the brilliant presentation and thanking you for, how insightful and interesting it was. So I'll take the next question from Shuala Law. Since the rig is a closed system with personnel in-breathing, circulating, and the air conditioner recirculating the air, what happens to the air conditioning system? Was it kept on or off in the galleys, etc., wherever personnel are gathered? And sorry, let me just add, he also asked another question, I mean, like a follow-up. Was there specific air filters and purifiers in the air conditioners? So you can respond, please.
Okay, so I'll take that question. So what we did before we resumed is that we had our HVAC system cleaned. And yes, you're right, it is a closed system, except we have an exception, which is in the sick bay. So the sick bay is an isolated standalone air system, and that's supposed to be the dedicated isolation center. So I don't know if you remember when Kingsley was talking about the mitigation measures, and if you have a suspected, so I'm taking the slides back so that you can see that if you have a single suspected case, person of interest is isolated in dedicated isolation room. So that is the dedicated isolation room because it has a separate air system from the rest of the rig. But yes, the entire rig is on a closed loop HVAC system. So what we did before we resumed operations is that we had the HVAC cleaning company come out to the rig, and they did do cleaning. They did change out all of the filters in the rig, and that was one of the measures we did in advance of us resuming operations.
Okay, thank you. Thank you, Kemi. So yet another question from Sean O. Can you please explain the requirements for use of masks? What types of masks were the personnel required to use in different work areas on the rig, both indoor and outdoor?
So let me clarify. Okay, maybe Kingsley should take that.
Oh, go ahead, Kemi.
No, I just wanted to clarify about masks outdoor, but I think Kingsley can answer that.
Oh, okay, so for masks, we use any kind of masks, right? Ankara, N95s, well, whatever masks. We also have special masks, clothed masks. We also distribute to people in the rig that don't have. However, the doctors use their own surgical masks, but for the personnel, we use any kind of mask. Indoors, everybody has to wear a mask. So because obviously it's a closed system, you only don't wear a mask when you're sleeping in your room or when you're eating. So, but when you're walking, everybody has to wear a mask. And outside, because some of the work we do is very strenuous. So let's say the rig floor hands, if most of them or all of them actually are in the same contact ring, they don't have to wear a mask. But if someone else is coming to in a different contact ring, coming to work with them, that person has to wear a mask. The person also has to get an exemption from the rig leadership that, look, I'm going to work in these guys in this contact ring. I'm going to wear a mask. However, put my name down just in case there's an outbreak so we can trace you and isolate you if possible.
Okay, thank you. I'm just going to take 2 more questions because of time so that we can round up this fantastic webinar. So I have one that is specifically directed to Kemi. This is Chima asking, you did mention only about personnel who tested negative for day 1 during lodging in the hotel. What if at the first PCR test the person is positive? What happens then?
Right. I thought I mentioned that, but let me go over it again. So if you are positive at either stages, either PCR test 1 or PCR test 2, we have a checkout protocol that will be activated. So essentially what this means is the contractor or whoever's, because the personnel that go out to the rig belong to different companies, right? Because I'm ODNL, Kingsley is Shell, there are other companies that come out to the rig to do certain work. So that company will be contacted, right, and said, your personnel XYZ tested positive. Please make arrangements in line with the checkout protocol. So we do have a checkout protocol that we activate when a person tests positive. So either on day 2, after the result of the first PCR test, or on day 8, after the result of the second PCR test. So either way, the checkout protocol still remains the same. And every contractor is aware of what those protocols are.
All right, thank you for that information. Okay.
And to add, we've seen benefits of actually doing 2 PCR tests, right, at the OTC. So because I'm trying to answer someone's question, we've actually gotten people test positive at the OTC. So, and that's why, that's the benefit of actually doing this test, to actually catch people and prevent them from coming to the rig.
Okay, thank you for that confirmation. So quickly, this is from Clinton, does each work group, in brackets with the same contact ring, have a maximum number of personnel? And if yes, what are the criteria for selection?
So no, there's no maximum number of personnel per contact ring group. If you guys all work together, then evidently that space has been deemed okay for the number of people that work in that space. So for example, on the rig floor, you would have 4 roughnecks at a time. You will have one, the work area has already been adjusted to the personnel that is required to do the work. So you have a set number of personnel that will do the work at any point in time. So for all those personnel that will do the work, they will be in that same contact ring. So there's no further division. You would all belong to that same contact ring since you all work together in that space.
Okay, thank you. Sorry, I had to close the Q&A icon, so because of time. Please, if you have any question, you can just forward it, email it to splagos@gmail.com, and someone will respond. I will put that email address as soon as I'm done with the remaining 2 or 3 questions. So Tony is asking, can you confirm that in 55 days you have not seen a COVID-19 case?
Yeah, I've answered the question, and that's why we do PCR.
Yeah,
right?
yeah. Exactly. So to confirm, no case. So Shuala Law again is asking, in between strenuous jobs, there should be some breaks to personnel to go to the isolated areas to remove the mask and breathe normally to avoid CO2 recirculation and contamination of the blood. I guess it's not really a question, it's more or less like a confirmation. I don't know if either of you can confirm.
No, but that's a clarification that we need to make. Like Kingsley explained, outside the accommodation, personnel working in the same contact rooms do who is not in your contact ring that needs to come and work with you for a short period of time. And then that person will get an exemption form to be able to work in that contact ring. And that person will wear a mask for the short duration that he will be working with you in your own in the different contact ring. So no, people outside the deck doing their normal jobs do not wear their masks all the time. That's not the case.
Okay, thank you. I think it's clear. So the last question from Anonymous: how do you enforce the use of masks within the facility?
So for us, it's very easy, right? For people that have been to the rig, we are very good at obeying safety protocols. You know, we wear hard hats when we have to, wear gloves, we wear eyeglasses, right? So for masks, it was easy, and the law is straight. If you're indoors, you have to be with your mask. And so far, everybody complies.
Yeah, just to add to what Kingsley says, the mask is considered as PPE, is considered as personal protective equipment. We all have undertaken in our, different companies that we must obey the safety protocols on the rig. So one of the safety protocols is that you will wear PPE. So it's not subjective. As long as you have agreed to work on the rig, you must obey the safety protocols, which include wearing masks. So it's not really up for discussion.
Okay, fantastic. Wow, thank you yet again, Kemi and Kingsley, for your time and for sharing your knowledge regarding this subject matter. Thank you so much. So at this point, I'll just quickly like to announce some upcoming events before we close this webinar. So we have yet another live webinar session, this time with Maria Angela Capello. The topic will be how to boost your resilience and leadership at work, 5 tips. So this webinar is coming really soon. The date is yet to be announced, but I would also tell you just how you can keep in touch so that as soon as the date is announced, you will definitely be aware. Another upcoming event is a technical training on Python for data science, predicting customer churn attrition by one of our very own, brilliant YPs, Brain John Aboze. This is actually a 2-day course. It's going to start tomorrow and it's going to end on Saturday, 10 a.m. each day, I believe about 10 to 2. The course fee is a very small 2,000 Naira to participate. If you are yet to key into this, it is not too late. You can still make your payments via Paystack with the link highlighted there before the close of business today. And another very powerful workshop coming up is the mini technology workshop. We have Industry 4.0 technology enabler for realizing a lower unit operating cost. It's going to be a very powerful 2-day workshop, November 25th and 26th, 9 a.m. to 12 p.m. West African time. There's a registration link to register. And of course, we also have the virtual field trip, coastal, estuarine, and tidally dominated reservoir characterization. We have 3 very powerful facilitators that will be taking us through this virtual field trip as well. This is going to be 9 a.m. on the 26th of November, Thursday. So, of course, like I mentioned earlier, if you need to stay updated as to all our events and activities at SPE Lagos, the best way to do that is to connect with us. You can do so by following us on all our social media platforms, LinkedIn at SPE Lagos Section 61, on Twitter, SPE_Lagos, on Instagram, SPE_Lagos, Facebook, SPE.Lagos, and YouTube, SPE Lagos. So on this note, I would like to thank everyone once again for attending this webinar. Thank our speakers, Kemi and Kingsley, for delivering such a very powerful and informative presentation, taking out their time and their expertise to do this. So thank you all, and have a good day. Goodbye.